Hey there, welcome to the Thriving in Wellness podcast with Haley and Caitlin. This podcast is for women who are tired of just surviving and ready to truly thrive. It's time to reclaim your health and build trust in your body.
Join us as we myth-bust nutrition topics, tackle your mindset, and dive into the nerdy side of women's health. Just a reminder that this is meant for educational purposes only and is not meant to be used for medical diagnosis or treatment. Now let's jump in. Hello, and welcome back to the Thriving in Wellness podcast. Today, we have a wonderful guest with us today. Her name is Amy. She's the owner of Pelvic Prescription, and she will be talking to us today about pelvic floor therapy and kind of how that relates to gut health. So, Amy, if you will, please introduce yourself and tell us a little bit about your business.
Of course. Thank you, Caitlin. So my name is Amy Newberry. I'm the owner of Pelvic Prescription Physical Therapy and Wellness, and we are a pelvic floor specialty clinic in Wilmington, North Carolina. We've been in practice for 3 years, but I've been a pelvic floor physical therapist for 5 years. And I do think there has been more chatter out in the internet about pelvic floor PT. But in case anybody doesn't know what we do, we are physical therapists that specialize in the pelvic floor region of the body. And so we help people who have issues with like their bladder. It could be like leakage, like bladder pain, GI issues, which we'll be diving into a lot deeper today, with like constipation or like fecal leakage. And then we also deal a lot with like pregnancy postpartum, so like pregnancy pain, and then like postpartum recovery, so that moms can get back to doing what they love.
Awesome. Thanks, Amy. I'm so excited to have you here. And thanks for touching on what we're going to be covering today, because I feel like I agree. Pelvic PT is definitely being talked about a lot more. I feel like, I don't know, maybe even a year or two ago, like I hadn't really even heard of it. So definitely getting the word out there, which I think is fantastic. But maybe it's just the world that I'm in, but I hear it most often talked about with like pregnancy postpartum. And I know that's such like I guess a stressful time on the pelvic floor, right? You're putting a lot of pressure and everything on there. But there's so many other areas of health that the pelvic region is impacted by or impacts. So I'm excited to dive into more of like the GI side of things, because there's still a lot going on down there in relation to the gut. So what are some of the GI symptoms or gut related symptoms that you're typically seeing in your practice in relation to the pelvic floor treatment?
Yeah, and I am so excited to talk about the GI side of things because I never get to talk about it on like a public platform as often as all the other good stuff. But the main stuff that we do treat when it comes to GI symptoms, like on one end of the spectrum, it'd be like constipation, and that from the point of view that we look at it is more of like a mechanical issue, which we can get into a little bit more. And then on the other side, you have like fecal incontinence or leakage, fecal urgency, and that can happen. All this can happen at any point in time. It doesn't even have to be related to like pregnancy postpartum. It could happen in somebody who hasn't had any babies yet, or it could happen in somebody who is like a little bit older, maybe like perimenopausal. And then we also treat like pelvic pain conditions like rectal pain, and then rectal prolapse, as well as like post-operation, like a bowel resection.
Mm-hmm. I feel like it would be relatively obvious. I mean, if you're aware of pelvic PT for this, to know like if you're having fecal incontinence, like you might need to seek out some help here. But how else might somebody know that they need pelvic PT for like a GI issue? Or like if we're talking to our patients, since we both work with people with GI issues, what are some things that we can listen out for that would be a good time to refer someone to pelvic PT?
Yeah, and one to echo what you said on that spectrum of like the fecal incontinence side of things, that's like super obvious. Like, hey, go see a pelvic floor PT if you're having like issues holding that in. And then on the other end of the spectrum that you guys usually see, I assume is more on like the constipation side. Is that right?
Yeah, I feel like it's a mix. Yeah.
Mhm.
Yeah, I mean, like diarrhea as well, but uh yeah, like to me, fecal incontinence is like we're not going to be able to resolve that completely just like through food and nutrition. Whereas constipation, diarrhea, bloating, I feel like there's so much that I can do there. So
Mhm.
when is a good time to be like, is this something mechanical and not just, maybe diet, nutrition, other things?
Yeah, totally. Yeah, I understand that. So one thing that I think would be, and this isn't like a perfect solution, I think, to be an indicator of like ding ding ding, they need to be referred to pelvic floor PT. But one indicator could be if they're dealing with like multiple pelvic floor dysfunction symptoms. So
Mm,
for example, if they have constipation, but they're also having pain with intercourse, like that would be a sign.
yeah.
Or they have constipation and they also have like urinary leakage or urgency, or pelvic pain, even back or hip pain potentially. So those could be good like screening questions for like your patients to see if they're dealing with any other like pelvic floor dysfunction symptoms. And there's actually a like screening form that was created by a pelvic floor PT in California, and it's called like the Cosine dysfunction, like pelvic floor dysfunction tool. And you can like Google it, and it's a list of like 10 questions. And if someone answers yes to like three of them, then that's an indicator that they're at higher risk for pelvic floor dysfunction. And there could be something bigger going on than just like constipation that's like not mechanical, if that makes sense.
Yeah. Yeah, I could see that being super helpful.
Mhm.
Yeah,
Um,
that's really interesting. And I think that could be a good tool for us to pull in as well. Because I've had a few patients where I've had one where it's like borderline fecal incontinence, but it was just because like the urgency was so bad with the diarrhea. Like it was a male that I was working with, this poor gentleman, like he was in his 70s and he had been dealing with this for like 40 years. And there was times like he just wouldn't eat because he knew he had to leave the house because that was an issue. I'm like, oh, this is heartbreaking. Um, but yeah, so that's really interesting. I'm definitely going to pull that in as a tool for myself. So, like along these lines, if someone were to come to you, and I'm sure there's different approaches depending on what their main symptoms are, right? But what modalities do you use for treatment, or like what would a treatment session potentially look like?
Yeah, and one thing that I think is important to mention even before treatment is like an evaluation,
Mhm.
because a lot of patients may not fully like understand what to expect in a pelvic floor evaluation, and so we do like to prepare people like in advance for that, especially because they might get kind of nervous. They're like, oh, is there an internal part and whatnot, and that can make people anxious. And so typically with pelvic floor therapy, like an evaluation does have an internal component as long as like the patient is comfortable like with that. When it comes to GI conditions, it is like very, very important and helpful for us to do like an internal rectal exam to assess more of the posterior pelvic floor muscles versus just like the front muscles. And then like for men, that's how we would assess their pelvic floor as well.
Mhm.
I don't want to scare people who could be listening to know that, but it is just part of like the medical exam, and it gives us the best amount of information about like what's going on in their
Yeah.
pelvic.
One thing real quick is I was wondering if, I mean, one, I think a lot of people still don't know about pelvic PT, and I'm hoping that continues to change, but that is such like a sensitive private area, right? And so I'm wondering how often it's like people might put up with the symptoms that they're dealing with just because they are hesitant. So maybe you could touch on ways to kind of ease people's fears or concerns about meeting with a pelvic PT. I think just understanding more about it could be helpful for sure.
Yeah, there's a stat that says it takes this is for women, a women's stat, but it takes women like up to 7 years before they actually like get help for their issue.
Do you
Oh
think
my,
that's more related to like just lack of awareness or more of the hesitancy?
I'm probably both, I
Yeah.
think. Mhm.
From somebody who is, I mean, I didn't come in for GI related issues, but for someone who has like worked with your team, you guys do a really good job of, helping your patients feel comfortable, going through like the internal exam part. And I always told, because I worked with Dr. Lydia, of like, I appreciated that she went through like there were just like a series of things that she said every single time before she started the internal exam. And it was so relaxing for me to be like very prepared for that. And then in my 6-week appointment with my OB, they just like threw up the sheet. She like jabbed her fingers in there and I like flew off the table because I wasn't prepared. And I was like, you did not gently use all of the words that Dr. Lydia used to like help me feel prepared for this.
Yeah.
Yeah, we get that a lot. Or those are stories we hear. We're like, oh yeah, I went to my OBGYN and they're like, I don't know if this is definitely not the same.
Yes.
Yeah, I've had a similar experience with like I went to a pelvic PT here. So shout out to Genev from Holistic Physical Therapy in like Paso Templeton area if you're here in California, but very similar. Like when you go to the OB, it's just like I don't know. It's routine for you guys too. So it's not like, oh, it's just routine, you go through it, but very interesting. I'm sure it's not
Yeah,
all OBs, but yeah.
I think like in pelvic floor training that we get, like it's like the like consent and like explaining what you're doing is like harped on really hard for us. And so like at any point a patient can decide that they want to stop. That's fine. They can like, at any point during an exam, and every visit could be different. And that's why we ask every visit the exact same questions, because
Mhm.
maybe someone changed their mind. And so I think in our training it was just very emphasized.
Drilled into you guys. Yes. So going back to just the treatment modality. So it sounds like initially when someone comes in, you guys will be doing some sort of evaluation, especially when it comes to GI. If the patient's comfortable, ideally getting some sort of internal exam so you can get the best understanding of what's going on. And then from there, what would be the next steps?
Yeah, and so typically from there, it will obviously depend on the what we find in the exam, but most commonly, the first step is a lot of like nervous system like downregulation. So a lot of people hang out in their little sympathetic fight or flight state. And so even in pelvic floor physical therapy, we touch on that because we know like the parasympathetic nervous system is like the rest and digest. And so if somebody's living in their sympathetic, then they are not going to be resting or digesting. So we focus on like breathing exercises. Maybe we'll do some like just talking about like lifestyle changes, like how can they incorporate activities into their life that will help them be more in a like parasympathetic state. Going through like vagus nerve activation type things, which again is just different tools to get you into that more like relaxed state so that your bowels can feel relaxed and empty. And so that's more of like the kind of like holistic point of view that we take. Also looking at like body mechanics on the toilet. Shout out squatty potties. We don't have to use the squatty potty, but some kind of stool to elevate your feet up so it changes the position of your hips to allow your pelvic floor to let go and relax better so your stool can move on out.
This is a totally random question, and I know you don't work with kids, so it's fine if you don't have an answer. But do you have any suggestions for like little kids? I'm thinking of like my toddler when she's sitting on the toilet because like her feet aren't even touching the ground.
I know that a lot of, again, this is just from like what I've seen. I know a lot of kids have like stools in the bathroom, right?
Oh, uh-huh, yeah, we have a stool.
But it's just not like high enough to get that position.
I don't think so. She uses it more to like get up onto the toilet. I could try to see like if her feet are still on it, if it would get her in that good position. Um, Because I also don't really want her like using the potty that's just like on the floor, because
Mhm.
then I would have to clean that out every time.
Yeah, not great. Um, I think that you have her like keep her feet on the stool. That would probably be better because otherwise, like her feet are probably like dangling,
Yeah.
right? And then that's just like not a good like stable position for the muscles to relax.
Mm-hmm. Yeah. Okay.
Mhm. Yeah. And so that's more of like the lifestyle changes that we talk with our patients about. We may teach them how to do like a bowel massage, and we'll touch on like hydration and fiber, but also encourage the patient to work with the dietitian. Cue you guys. Um, and then the reason why that we're focusing so much on that is because we want everything to relax. And a lot of times when our patients who have constipation or trouble emptying their bowels, we'll find that their muscles are really tense. So we'll find that their pelvic floor muscles are like tight, or their abdominals are tight, or maybe their glutes, their hip muscles are tight. And altogether, that can impact the function of your pelvic floor, because then if your pelvic floor is like stuck here tight, then it won't be able to relax to let the stool move on through. And so we'll do a lot of like hands-on therapy to get the muscles to relax and stretch and allow the stool to like evacuate. And that's like one side of the spectrum. And then the other side is some of our patients have dyssynergia, which is basically where they think they're trying to push out and poop, but they're actually like squeezing and like kegeling when they
Mm-hmm.
poop. And so they don't have the coordination. And that's why the internal exam is so important, because during that we can actually say, hey, like pretend like you're trying to poop. And sometimes people legitimately will squeeze their like their butthole shut. And I'm like, oh, like that's not right.
Yeah.
Yeah, so that's a really big thing that we'll actually see, that people are not relaxing.
Right.
Um, that's something that I um noticed and was able to like feel in my body when I was doing like push prep for labor, where I thought that I was pushing, but I was not. Uh,
Mhm.
and so I can get that it's like a similar concept when you would think that you're trying to poop and you're not.
Yeah.
Exactly.
I was gonna say too, it's almost like a love-hate thing that the nervous system is involved in like everything now. Because
Mhm.
it's like we talk a lot about the nervous system and like with our patients too, because there is such a big connection between the brain and the gut, and then our musculature and everything. So if we're constantly gripping and everything in that sympathetic state, I think it's great that we're realizing this is such a big piece of it, but I also find that it's really challenging for people to accept that that's a part of the treatment, as well as like work on that, you know? So, I'm glad you brought that up though, because I think it's always important to just recognize how influential that can be on like almost every aspect of our health.
Yeah, I saw you smile when I said it. I was like,
I was like,
oh.
So I'm sure this is going to be different for everybody, but how long should somebody kind of expect um to be working on some of these issues, or to start to see some progress if they're coming to you with like a GI issue?
Mhm. So if to see any like change or progress, that could happen in as short as only like four weeks, or like 4 visits. Um, that doesn't mean that their symptoms are totally good, but usually people will come in like for a few treatments and then already start to notice like, oh, hey, like I'm pooping a little bit easier. My muscles were really holding back a lot, you know, and just making some of those like lifestyle changes makes a huge difference. But in order to see like more of like a long-term change, it probably takes more like 2 to 3 months total, just because of the first like 4 weeks, 4 to 6 weeks might be focused on like lengthening and like getting the muscles to relax. And then the rest from there on out is coordination training for the muscles to like re-educate them and then strengthen them so they can hold what they like learned. And that takes like physiologically, that takes usually about like 6 to 8 weeks for the muscles to like learn that.
Yeah, very interesting. And I'm sure that just like with our work, but a lot of that is dependent on how much patients are doing outside of their treatment sessions, because it's not like they could just come to pelvic PT once a week and then have everything resolved if they're not doing anything outside of that.
Yeah, it is. Pelvic PT is no joke, a lot of work. And I won't even like sugarcoat that, because I think we do have some patients that come in and they realize like how much work it's going to be. And they're like, yeah, sorry, like this is like, I didn't know how involved this was going to be, because they have to do so much at home, because we only see them for like 1 hour out of a whole week or 2 weeks. And that is not a lot of time. And so like a lot of it is on them, and we're kind of there to guide them and be like their accountability. But a huge part of it is them doing it at home.
Yeah, well, I think that's true for like any sort of physical therapy, but we also see that too. Like we've had our fair share of patients that I don't know. I hate to say this sometimes, but they expect you to make all the changes for them. It's like, I'm not living with you. I'm seeing you once every couple weeks, 30 to 45 minutes, maybe, right? Maybe an hour. And so it really is up to you. And obviously, it sounds like this is something you guys do too, but like coaching through, like, how can you fit this into routine? Like, is this a priority to you right now? Which is always challenging too.
Yeah, it's always a very hard conversation to be like to keep them accountable and be like, how important is this? Because sometimes it's not, and maybe it's the wrong time, and like that's okay. But it is definitely a lot of work, and I'm sure for your patients as well.
Yeah, and I'm sure it's similar with pelvic PT, but like with nutrition, I think a lot of people come, depending on what they're coming to us for, but they come in with this mindset that it's going to be a short-term thing, like they have to do this one diet or whatever for a few weeks and then they're fine. But really, it's like the way we practice, it's lifestyle change. And so I'm sure for you guys too, they're like once their initial treatment is done, they've seen all this improvement, there are going to be lifestyle things, management that they need to keep up with so they're not coming back to like the same spot.
Yeah, they definitely have to continue doing some of the things that we like tell them to do. They may not have to do it at the same frequency that they were doing it like to get better, but they definitely do have to keep up with like some lifestyle changes. And we try to give them like a ton of tools to be able to like, if symptoms do kind of arise again, they should know how to like self-treat. But sometimes it's just, I've found that it's hard for patients to do that even after we give them everything. Sometimes they still just need a little bit of like accountability and like guidance.
Yeah.
For sure. So I'm sure there are tons of myths and things about pelvic PT, especially when we're thinking about it from like a pregnancy or postpartum standpoint. But are there any myths that you can think of that's more related to this GI stuff?
It was a little bit hard for me to think of any myths, but I think the biggest thing is just that people are surprised that we can treat these types of things. And not all pelvic PTs have the training in bowel. So like if you are searching for a pelvic PT that does this, make sure to like ask, like, hey, like have you done like bowel training and like, like a rectal examination and whatever. Because it is like it's like a higher level like course. So some people are surprised that PTs can do that. And then I think also on the pulling in men's health, I think people are usually surprised that men have pelvic floors too, and that they can deal with the exact same symptoms that women deal with, including all the GI stuff.
Yeah. Yeah. I think that's important. I know we focus on working with women and our practices mainly, and then this podcast is kind of geared to that. But if you have husbands, boyfriends, loved ones, whatever, and they're dealing with some of these things too, I've definitely thought about talking to some of my family members about it. We didn't plan this question, but I'm kind of curious if you have any suggestions on this. If someone is listening to this and they realize like, maybe I should go in for an evaluation, what is typically the best approach to finding a pelvic PT? Is there like a good resource online, or is it just reaching out to their doctors for a referral? And it might be different everywhere, but if you have any recommendations on how people can navigate that.
Honestly, I think just Googling it in your area is probably the best thing. There are a couple of like pelvic floor PT search engines, but honestly, those are just based on people like paying to have their name on it.
Yeah.
So I think just like Googling and then going off like Google reviews and whatnot is probably the best way to go about it. I know some states require referrals to see PTs. In North Carolina, you are not required to have a referral. So it would depend state to state if you need to like talk to your doctor about that.
And so you could reach out if you find a pelvic PT, maybe you could reach out to them to ask what the rules are.
Yeah, totally. And most states have direct access now. So even if you reach out to a PT and ask about it, they can tell you, okay, yeah, you can go ahead and come in for your evaluation just within 9 visits. We need a referral from your doctor to continue treatment.
Yeah, that was my experience, that they needed it after a certain period of time. So,
Mhm.
all right, good to know. Thanks. All right. We always like to leave people with something that they can think about or a tip. So what's one tip, or if you have more than one, that you want to leave listeners with today?
Okay, my biggest thing is get you a squatty potty and stop straining on the toilet, people. Don't hold your breath when you're pooping. Make sure to exhale your poop out and have a squatty potty beneath your feet.
That's a good one. You're like a Squatty Potty spokesperson.
Yes, I should get paid.
Yeah. Okay, one more question on that, actually. Sorry, keep bringing up more things, but I've heard that it's not great for a number of reasons, but for the pelvic floor, if someone is struggling with constipation, or maybe for other reasons, they're just kind of sitting on the toilet for a longer period of time. Is that bad for the pelvic floor? Something you need to be like, maybe take breaks, or what's the suggestion there?
Yeah, you typically don't want to sit like hanging out on the toilet. Like we don't really recommend like don't really pull out your book. Like don't read on the toilet.
Not a
Just go
hangout spot.
yeah. Don't be scrolling on your phone. Just go in there and like do your business. If you end up sitting for like more than like between 5 or 10 minutes and like nothing is happening, then get up and like do something else until you like feel the urge again to go. But you don't really want to like keep sitting. And I think the reason behind that is because of the worry about like the straining part.
Mhm. Okay.
If you're sitting there like straining too long, that can like weaken the pelvic floor, like weaken and or tighten it. So that would be counterproductive to like what you're trying to do.
Yeah. Okay.
Yeah.
Anything else,
Well, thank
Caitlin?
you. No, thank you so much for joining us today and talking about this maybe less heard about piece of pelvic PT. We really appreciated your time and all of your knowledge.
Okay, thank you. It's so fun talking about the poop side of it.
Yeah, a conversation that a lot of people, like I forget, is uncomfortable for a lot of people, but so important to talk about. So
Mhm.
thank you so much, Amy.
Thanks.